The defining event of current times has become the COVID-19 global pandemic. Economic and social displacements rattle the entire human experience. But as the world and Northwest Ohio emerges to a new normal, much of the old normal remains, including the disturbing reality that opioid overdose remains the leading cause of accidental death in the United States. Addiction to opioids, which includes prescription painkillers, heroin, and deadly synthetics like fentanyl, has become a staggering crisis. In 2010, the Lucas County Coroner's Office reported 8 opioid deaths. In 3 years, they increased tenfold. Then, that number quadrupled by 2017, when 365 people died of opioid overdose. In 2021, the last year for which statistics are complete, there were 552 opioid-related deaths in the 21 counties served by the Lucas County Coroner. Of those 552 deaths, 276 were in Lucas County, a number that has more than tripled since 2014. Although the numbers are slightly down from 2020, this is a staggering increase of nearly 680% since statistics were first kept in 2010. In fact, in 2007, drug overdose became the leading cause of accidental deaths in the United States. It remains that way to this day. It cuts through every social, economic, and demographic classification.
No specific demographic. It affects anyone and everyone.
Tammy Smith is a counselor with the Lucas County Sheriff's Drug Abuse Response Team. DART has 2 primary functions. Officers responding to overdose calls link individuals and families to addiction recovery services, like Harbor, and her role, which is to destigmatize the disease of addiction through education in schools and the general community.
It affects every single economic level. It affects every single demographic. The DART unit has responded to individuals that are behind dumpsters, and we've responded to individuals in multi-million-dollar houses. The youngest person that we responded to was 16, and the oldest person we responded to was 93.
Although the demographics of addiction cannot be categorized, symptoms can.
Some of the warning signs of an individual that might be experiencing a substance use issue might be changes in behaviors. Look at, are they changing, friends, family? Are they starting to snap at individuals? Are there changes in spending habits? Are they asking for money? Are you noticing objects and things coming up missing around your household? Are you noticing physical changes within that individual? Are they starting to either gain weight or lose weight? Are you starting to see sores or lesions in places that aren't typically there?
So what are opioids? Where do they come from? Opium is the original opioid, and it is derived from the sap of certain poppy plants. Its euphoric and pain-killing properties have been known since biblical times. Morphine and codeine were extracted from opium in the early 1800s, and heroin was synthesized from morphine in 1874. In fact, Bayer Pharmaceutical trademarked the name heroin for a cough syrup in 1898. Modern medicine continues to use morphine and various other synthetics for legitimate medical purposes to treat pain. You might recognize the names of some of those common prescription painkillers: Vicodin, OxyContin, Percocet. People who take opioids are at risk of developing addiction or substance use disorder, which is defined as a craving for a drug and continued use despite harmful consequences. Opioids are highly addictive, in large part because they activate the powerful reward center of the brain. And the American Medical Association defines substance use disorders like addiction as a disease.
The Mental Health Recovery Services Board supports the idea that substance dependence is a disease of the brain, and in fact mandates all of our contracted providers to do provide evidence-based treatment services to effectively address those disorders.
In the late 1990s, pharmaceutical companies persuaded the medical community that patients would not become addicted to opioid pain relievers, and healthcare providers began prescribing them at greater rates. This led to widespread misuse of prescription opioids before it became clear that these meds could, in fact, be highly addictive.
What we saw as a direct result of tremendous marketing and a lot of money spent is the use of these drugs and the prescribing of these drugs went up like a rocket for a long, long, long time. That got a number of people addicted. At some point, many of them moved into heroin. Now what we've seen, of course, is this evolve. So it starts with the pain meds, goes to the heroin. Now we are dealing with fentanyl, which is so much more potent than heroin, which is now being mixed into virtually every other kind of drug.
Fentanyl is 50 to 100 times the strength of morphine and is legitimately used as an anesthetic and for chronic end-stage pain management. However, it is increasingly used in the illegal recreational drug trade with increasingly deadly results.
Often the problem is the combination that are adding together. And when we analyze the powder or a residue, often we find 2 or 3 drugs in that powder. So the person may think they're using one drug without realizing that they're actually using more than one, even in that powder.
Add to all of this a global pandemic that virtually shut down entire segments of society. And addiction thrives in isolation.
So when somebody is struggling with substance use challenges and when they're new in recovery or maybe, seasoned in recovery and they have years under their belt, one of the main things that helped them to get to a place of recovery or a healthy space with their journey was community. So the pandemic had really, it made it challenging for individuals that turn to substances to cope with loneliness. So, you're gaining a sense of community in your recovery and trying to find that path that works for you. But then the pandemic kind of put a halt to all of that and made it more difficult for everyone in how we were going to respond to our own challenges.
Today, opioid addiction can be addressed with medically assisted treatments. You may have heard of Suboxone and Vivitrol, which reduce withdrawal symptoms and cravings. Inpatient and intensive outpatient treatment can introduce people with substance use disorder to ongoing recovery programs, like 12-Step, which can provide a daily reprieve from using, contingent upon maintaining an active program in their lives. But real hope lies in prevention.
The real state of hope is understanding that the intervention is prevention. The more that you reach out to people and let them know that the help is there, you're going to start to curb or see that trend that you're seeing go down.
Yeah, prevention is the most important thing we can do. It's the cheapest thing we can do. It has the most long impact.
You can do your part by disposing of unused and unwanted medications by taking them to safe and secure drop boxes that are located throughout Lucas County. This reduces access and potential misuse. If you are in need of treatment services, call the Crisis Care Helpline at 419-904-CARE. For any crisis, you can also text 4HOPE to 741-741. This presentation is made possible by Harbor through the Mental Health and Recovery Services Board of Lucas County.